Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I usually work really hard to make these videos timeless, right? So that if you're going back through our blog in a year, you'll find something that makes sense to you. But right now is a really unusual time, right? We are here in April of 2020, and we are in the middle of this COVID quarantine. And a lot of you attended a webinar that we did last week. We had over 1,000 attendees, which was pretty amazing. And we talked a lot about having a plan for when you reopen. And a couple questions came up that I want to give a little bit more thought to and share with you. And so the question is your schedule going to look like a ghost town, right, where there aren't a lot of patients coming in for whatever reason, or is it going to be Grand Central where you are slammed and you just don't even know how you're going to get them all in? Well, we're not sure exactly how it's going to go. I think a lot of dental practices are expecting to hit the ground running at full steam. I think it's going to be a combination of the two. And so here are a couple things to think about and a couple of questions that we've gotten a lot of in the last couple weeks. One is, should we add more time to our hygiene visit? And then the other is, should we shorten the hygiene visit so that we can get more patients in? So let's talk about these individually, but really kind of together at the same time. So one is, should we have more time at our hygiene visits? I think initially, and here's the thing, I also know, and I want to just let you know that we're in this with you too. This has also affected our business directly, and we're all looking for reopening and getting back to business, getting back to work, and everybody serving their clients and patients in the way that they love to and making a living. So we're all in this together, and what we do know is that we've got to come up with a plan to recover this lost revenue. And also, we might need some extra time with patients to talk about the PPE, to talk about their experience during the quarantine, and just to reconnect, right? So it might be for a short period of time that you might want to add another 5 to 10 minutes to the hygiene visit. On the flip side of that is, man, we're imagining all these patients from the last 2 months are going to need to get in, and how are we going to fit them all in and extend the time that just doesn't even make sense? I do think we're all going to have to be really open to some alternate hours, right? And maybe you are working some different shifts between team members. We're spreading some of those things out. And here's the other thing too, is perhaps you might consider working as a team in hygiene, right? Doing something like assisted hygiene. I think this would be a great solution to handling a heavy volume of patients that are coming in a short period of time. And here's the great news about that, is with that model, you can both see more patients in less time and extend the hygiene visit. Because here's the thing, if you're working as a hygienist and assistant team out of 2 rooms, or even if you have maybe a spare room where you can take x-rays, or the assistant can help with some of the pre-screening, you can get creative with your space, but the entire hygiene appointment might be longer, so maybe it's 70 minutes, but actually the hygienist time might be less, right? It might be 40 minutes, so you can see more patients. So there are some creative things that you can do to really work around this. A couple things that I want to make sure that I point out and really urge you to keep in place is, keep in place your diagnostic processes. One of the things that we might be tempted to do when things get really busy, or we're just unsure of kind of how to manage these new conversations, is we might say, hey, right now we're just going to focus on getting patients in and cleaning their teeth. But here's the thing. If we do not do our tried and true diagnostic processes, right, taking our radiographs, doing our period charting, doing our oral cancer screening, thoroughly reviewing our patient's medical history, if we don't do those things now, we're going to get out of the habit. And it's going to be harder to bring them back in later. The other thing too is, our patients are going to come to expect us to just jump right into the prophy. So why do we need all this time doing all those other things, right? Remember, we train our patients for what we want them to value. The other piece is, right now, your patients need to know what is in their best interest with regards to their health. They need to know if they have decay or periodontal disease. And right now, your practice needs that treatment, right? So if you take away that diagnostic piece, you're going to be losing a lot of the care that you're delivering to patients, and also the potential for revenue recovery. So Yeah, I think you might need a little bit more time. Someone might need a little bit more time. It doesn't necessarily have to be the hygienist, right? It could be another team member to kind of visit with the patient maybe ahead of time or at the end, to have a little more connection time, to talk maybe about some of the changes and things you've put in place. And also, if you are really busy at first with patients wanting to get in, then you might need to work as a team, right? You might need to get in a few more patients a day. You might need to extend your hours a little bit. You might need to just work a little bit more creatively. We're going to be sharing more of these tips, and we're going to be having some programs that you guys can take advantage of to learn how to implement some of these things in your practice. So just keep an eye on your email, and we'll get that to you as soon as we can. All right? Be safe, be well, and stay positive.